Will sucks at recording things, by the way. Remember my polar plunge?
Mr. DeCoste.
Dr. Gallos?
Nice to meet you. Come in.
How you doing today?
Good, how are you?
Hanging in there. Hanging in there.
So we spoke briefly on the phone. What can I do for you today?
Well, my wife thinks that I should be here.
Well, why do you think your wife asked you to come in?
There's a lot going on. She just had our second kid within less than a year.
Mm-hmm.
So we have 2 newborns. I just got a new job with a huge defense attorney, or a huge law firm.
Congratulations.
Thanks. And just home life and work life is just piling up.
I see. I can only imagine how stressful this is for you. Could you elaborate a little bit how all this is making you feel?
It's overwhelming. It feels like a lot of things are just coming down on me right now.
Mm-hmm.
A lot of things at once. It's a lot to handle. Honestly, it's just kind of depressing.
I see. Okay, so you have a lot going on. You just started a new job,
Yep.
wife, second kid. I can see how that can be very stressful. Well, the Beck depression inventory I had you fill out prior to the session seems to suggest that you're experiencing some mild depression. I'd like to ask, when you have these feelings, do you find that you have any way of de-stressing, any way of coping with these feelings?
Not really. Not anymore. It's just, I feel just like I'm trapped, you know, and there's nowhere really to go. My wife and I used to be able to do, fun stuff, go golfing, sporting events, but now it just feels like I'm trapped and I just have to bear it all, just carry it with me,
I see. Are there any other feelings you feel like you're having at this time? Would you say that you feel a sense of helplessness given the situation?
Definitely feel a sense of helplessness. Don't really know what to do right now. As I said, the job, the family, the kids, wife, it's all just piling up and it's just getting bigger and bigger and harder and harder.
Mm-hmm. You're expressing 2 major feelings in that of being overwhelmed, and the depression obviously is a huge factor in all of this. What exactly do you find yourself doing when you have these feelings?
A lot of it's at work or at work at home. Being a defense attorney is tough. I have to keep my clients in check, make sure everything's going well with them, while also balancing family life. And when I'm at the office, it's all work. I come home, I can't even spend time with my family. It's work again. I'm always going through papers with my clients, and work seems to be the biggest problem. It's usually just work-related stuff that I seem to be doing, and then I just get stressed, and it adds up.
You mentioned that in the past, when you have felt stressed, you had outlets like golfing, going to sporting events. What stopped that?
Well, the first kid definitely stopped it, and then now with the addition of a second kid, the new job, bigger law firm, bigger responsibilities, I don't really have the time that I can just take away from it and do stuff with my family.
Mm-hmm. Right. Well, do you think maybe the elimination of these pleasures that you used to enjoy has maybe allowed the symptoms to intensify?
I never really thought of it like that, but now that you bring it up, I would definitely say so. Like you said, you call them outlets. I would be able to do these things and forget about the real world temporarily, but now it's just all real world. There's nothing else.
Right. Well, I find that these coping skills, well, before I get into that, would you say you were happier when you were able to go golfing or going to sporting events, spending time with your wife, doing the things you enjoy?
I mean, yeah, I was a lot happier, but family comes, and I'm still happy with my family. It's just things just are adding up, and
right.
It's rough.
I'm not suggesting that you are not of course you're experiencing mild depression, but you're not upset that these things are happening. What I find is that by not that there should be a balancing act. That's what I'm seeing. I'm seeing that your elimination of the things you enjoy doing and the constant stress and your inability to step away from the stress is maybe fueling your symptoms and acting as a facilitator for the depression and perhaps the stress and things of this nature. Before we continue, are you familiar with the cognitive behavioral approach to therapy?
Nope, I can't say that I am.
Well, for the most part, it draws a connection between feelings and maladaptive behavior and cognitions, thoughts. To put things into perspective, I like to offer clients the analogy of a lemon. Take a lemon, for example. Would you agree that a lemon is yellow, right?
Well, of course.
Well, let's say I place a blue piece of glass in front of the lemon and then ask you to describe it. The color may be distorted given that yellow and blue make green. And so, to put things into perspective, using the scope of cognitive behavioral therapy, the lemon is reality, while the lemon, as seen through the blue glass, is your distorted cognitions. So what I'm seeing is how you're viewing the situation may be fueling your emotions. So what I would like, have you ever thought of effective problem solving as to how you can manage and deconstruct these stresses in your life?
No, with so much going on between work and trying to adapt with the new family, I haven't really had much time to think about anything besides clients.
Which is reasonable. But what I find is you seem to be experiencing burnout, which is normal given you've just stepped into a big role, you're at a big law firm, lots going on in your life, but by bringing work home with you, you're you're likely to only experience more anxiety, more stress, and you're unlikely to be as effective as you would be if you had a means of, after your 8-hour shifts or however long you work for, that you come home, you escape from that.
Leave it at work.
Yeah, if you leave work at work, you allow yourself to decompress from stress. You might find that you may actually be more effective in the workplace. What I also find is in human verbal behavior, certain thoughts about an upsetting event such as work, home life, can actually become more generalized to many other aspects of one's life. And I find that would you say you're looking for an escape, and that you try to maybe bury your problems so as not to burden others?
I mean, not so much burying them, but an escape every once in a while, I think,
Right.
would be ideal.
Well, these feelings that you're expressing are normal. Feeling stressed, anxious over a new job, things that happen in your life. I don't find that we need to escape from them as much as we need to be able to handle them. And so, to get rid of these negative experiences, I find that obviously coping strategies, effective problem solving, but obviously something needs to change. And would you agree?
Yes, what do you
That is
suggest that I would do, though?
Well, what I find with many of my clients is that if I enable you to see the futility of the strategies, or lack thereof, that you're using now, we can identify these problems. So, for example, with the depression, we talked about coping skills, problem solving. For instance, you talked about a lack of time for the things you used to enjoy. have you ever thought of maybe hiring a babysitter once or twice a week so that you and your wife could go out maybe?
We haven't really thought about that. Again, they're both newborns, so we kind of
Right.
need to be there. I mean, we could talk about it. I think it might help. But again, with the newborns, it might be
Right.
tough on a babysitter.
At this moment in time, I would agree with that. But maybe after they get a little older, you can trust someone to take, maybe not even a babysitter, maybe your parents, someone that you can rely on to support. I find that if the parents have a way to de-stress, not only do they become better parents, but also it'll allow you to reconnect with your wife while also giving your mind a break from all this stress. I find that anyone under immense levels of stress it's not mentally healthy. And also, as I mentioned before, I find a big problem is leaving work at work. I mean, if you bring work home with you, obviously you're never escaping. You're on this constant treadmill of stress. Like, it gives you no time to really relax and unwind.
It's such a demanding field. I don't really have time that I can just do it all at work.
Mm-hmm.
Part of me has to bring it home and continue to do it at home.
Right. Well, that might mean spending a couple hours after work being at work, but I find that the environment change also facilitates mood change. So I find that maybe you might have spent a few more hours at work, but if you were to leave it at work, maybe you would start to mitigate some of those symptoms.
I think that might help. Leaving it there, spending a few extra hours in the office,
Right.
still making my clients happy while being able to make my family happy as well.
At this point in the session, we focused a lot on the negative aspects of why you're here, the feeling overwhelmed, depression, helplessness. What I find many clients fail to do is focus on their strengths. Could you tell me a little bit what you find your strengths are?
Yeah. I consider myself to be successful at my job.
Mm-hmm.
Help out a lot of clients. Again, the new job isn't a joke. It's a pretty big deal.
Mm-hmm. And you should be proud of that.
And due to my hard work, determination, etc., it's gotten me to that job.
Mm-hmm.
And I definitely take pride in a lot of my work.
Right.
I like to think I'm a good husband, a good dad
Mm-hmm.
to my kid, even though they're newborns. Still think that I'm a good part of my family, bringing in most, if not all, of the income,
Mm-hmm.
being able to support them.
Right. And I find with clients, if they're able to focus on these strengths, it better equips them to handling these life stressors. That, hey, you've accomplished some great things, you've overcome stressors in the past, gives you no reason why you can't accomplish this in the future. I mean, right now you're incredibly stressed, feeling a little bit depressed, but that doesn't mean you won't be able to get through this. It's just a means of how. We're coming towards the end of session. What I would like you to do is, I would like to see you again, obviously.
Definitely.
I would like you to come in, perhaps a couple minutes early next time, fill out the Beck inventory for depression again. This way, it gives us both a means of assessing treatment, because I want to get feedback from you. Also, I would like you to fill out maybe a list of problems that you would like to work on, and maybe when you're feeling stressed, find a means of de-stressing. Don't stay in that state of tension. Maybe you can't go golfing, maybe you can't go out to a sporting event with your wife, but maybe you can find something else that for that moment will allow you to de-stress. That's all I really have for today. I greatly appreciate you coming in.
Thank you, doctor.
Thank you. Have a nice day.